Hi, everyone. Welcome to our webinar today. My name is Cindy Clowner. We're excited to have you with us. We're going to give people a few minutes to get connected and get into the room so they don't miss anything. So we'll just, as you're coming in, you'll be coming in on mute. We'll give you a minute to get connected via audio before we begin. Once you are in the room, though, we encourage you to let us know who you are and where you're from. And so if you can drop it into the chat box and share where you're joining us from today, what institution or organization you might work with, perhaps even what your role is there. It would be great to see who all is joining us today. We're just going to wait a couple more minutes as we let people cycle into the room and get connected with their audio. We're really excited about our session. We've got a great presenter today. We just turned on the chat for folks, so you're able to drop that in there now, or you should be able to drop that in there now, your name, where you're from, and what you do there. And we're excited to have a former director of the Higher Education Center, Dr. John Clapp, with us today. So as you are coming in, we're just giving everyone a few minutes to join us. Please drop in the chat who you are, where you're from, and what your role is. We'd love to see who's joining us today. Because we've got a big group of folks, which we're really excited about. It's great to see folks from lots of different kinds of institutions today. We've got a number of large public institutions, but also some small private. So that's great to see too. And folks working in wellness and prevention and AOD specifically, but also I saw some fraternity and sorority life folks and conduct and community standards. We're happy to have all of you with us today. It does look like we've got the bulk of everybody in the room, so I'm going to go ahead and turn it over to my colleague, Anthony Gonzalez, to get us kicked off.
Thank you, Cindy, and hello, everyone. As Cindy mentioned, I'm Anthony Gonzalez, the program coordinator here at the Higher Education Center for Alcohol, Drug Misuse Prevention and Recovery. I hope everyone is doing well out there, and I want to thank you all for joining us today for our webinar featuring Dr. John Clapp. We have a few housekeeping slides we'd like to go over. We've recently switched to Zoom as our broadcasting platform, and we're excited about this switch and believe this will provide a better user experience. If I can direct your attention to the bottom of your screen, this is where you'll be able to submit your question for our presenter. We welcome all of your questions, and please feel free to submit them at any time throughout the session. We'll field the received question to our presenter at the very end. We also encourage you to learn more about becoming a member of the Higher Education Center, which includes access to our Screen U program. Screen U is a web-based screening and brief intervention referral to treatment program. We've recently launched a new demo of the program, so we encourage you to take a look. You can do so by searching go.osu.edu/ScreenU demo for access. And of course, you can learn more about the benefits of becoming a member by visiting our website at hecaod.osu.edu. And with that, it is my great pleasure to introduce to you our presenter for today, Dr. John Clapp. Dr. Clapp is a professor at the School of Social Work at the University of Southern California. Dr. Clapp is known internationally for his research and translational work in the field of alcohol problem prevention. A fellow in the American Academy of Health Behavior, Dr. Clapp is currently studying the system dynamics of drinking events with a team of engineers and computer scientists with the goal of developing smart, real-time prevention applications. He has published more than 100 journal articles, with his work appearing in the Journal of Studies on Alcohol and Drugs, Addiction, Drug and Alcohol Dependency, and among numerous other top research journals. Dr. Clapp has been awarded more than $32 million in grants and contracts and has been principal investigator on over 20 funded projects. Dr. Clapp was funding co-editor-in-chief of the International Journal of Alcohol and Drug Research. As a leader in the prevention of alcohol-related problems experienced by college students, he served 6 years as the director of the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. He's also served on the Substance Abuse and Mental Health Services Administration's Center for Substance Abuse Prevention National Advisory Council. Dr. Clapp's work and expertise has been featured in numerous international media outlets with coverage in the New York Times, the Washington Post, the Daily Telegraph, ABC National News, among numerous others. Thank you so much, Dr. Clapp, for joining us today, and it's my pleasure turning it over to you at this time.
Thank you, Anthony, and thank you, everybody. let's see, make sure I got the screen going. There we go. So I'm sure a lot of us are here for answers and for concerns about the relationship between these two molecules, alcohol on one side of your screen and COVID on the other. And I wish I could start off by saying that I had the answers for you. This is one of those kind of topics that is different than anything I've ever presented on. I've done a lot of talks over the years, in that there's really no good science yet on no great science on COVID in general, and then almost nothing on the relationship between alcohol and COVID. That said, the goal of the presentation today is really to try to stimulate some conversation, make some predictions based on what we do know about alcohol use among college students, about the common context of use that college students drink in, talk a little bit about how COVID is changed in the responses to COVID has changed the way alcohol is sold and consumed in different places. And then talk about how campuses are responding to the COVID situation and how that might influence alcohol prevention efforts. All that said, let's see, and I am not able to advance my screen here, Anthony. There we go. When you that was my dumpster fire joke. So basically, I'm sure several of us are really concerned when during the spring break and the outbreak started, we were seeing pictures like this, news coverage like this. And I know I was, and I know I was thinking to myself, how do you practice social distancing on a college campus? There's so many implications to all this that it was difficult to kind of imagine a path forward. This, of course, as you all know, was complicated by the lack of a coherent national strategy. So a lot of what I'm going to say today, which made this talk even more challenging, is based on huge regional variations in how regions, states, cities addressed COVID. And there will be, I imagine, the same type of variation in how universities and colleges around the country address the epidemic. What's interesting is while there's variation around the country on how we look at alcohol and drugs on college campuses, the level of variation is nowhere near the level of variation that we have with COVID. So it presents a particular set of challenges. Again, I wish I had all the answers, but I do think that we should look at webinars like today as the first step in starting a dialogue and really starting to make an effort nationally to look at how we're going to address this moving forward, because I don't think it's going away. At least the evidence to date suggests it's not going away anytime soon, and how we might be ready for something like this again in the future. Oops. So first things first, and this is kind of a poll question that you don't have to answer. If you want to throw it in the chat box, it's fine. But as I was preparing for this, I realized there's probably 3 different potential audiences here. I'm assuming most of you are responsible because you got this through the Higher Ed Center for alcohol and drug prevention or some kind of a wellness activity on your campus, Greek life, whatever the case might be, recovery programs. And so that's your lens. That said, I know having been a dean the last couple years, thankfully not doing that anymore, and an administrator for several years before that, colleges and universities around the country are scrambling to develop COVID prevention policies. So some of you might be looking at this from that lens with being curious about how alcohol might impact your efforts. There might be some of you that are responsible for both. And then I'd just like to pose the rhetorical question. If you're one or the other, have you talked to your counterparts on the other side? Because I think that is going to be a critical piece of this moving forward, that that campuses really start to consider alcohol as a threat to their COVID-19 prevention efforts. Other caveat, we could talk about other substances too. Cannabis use, of course, comes with its own kinds of challenges, especially in the smoke form, tobacco use, and so on. But I'm going to focus primarily today on alcohol, as it's the primary substance that college students use. Okay, so let's review a little bit about COVID-19. And this next slide, you all know this. I did reluctant to even put it up, but I did put it up because it's useful to think about this as the basis for what started discussions among college administrators around the country. And as they started to kind of develop their own strategies, they were kind of thinking in terms of these sorts of things. Okay, putting sanitizer stations around campus. Do we require face masks or not? Will we be online or offline? Social distancing. Now, pretty much there was, in the spring, as we all know, most campuses had a similar response. There was kind of the shutdown. We went online and moved forward. And then coming back, there's going to be some variations of these things at most campuses, but not all campuses. So there will be some business as usual campuses. As an aside, in case anyone's interested, there actually is scientific literature on all these things. So these are actually all evidence-based from previous outbreaks and epidemics. So this, this isn't just something that came out of nowhere and put into policy. There's actually public health literature around all these things. Okay, so what do we know about COVID-19 and drinking? And I've done a number of lit searches. I've talked to a number of fellow researchers around the country. There's really not much data out there right now. There's several studies that are going. I've got a study going that I'll talk a little bit about later. But we don't even really have data yet. So it's really premature to say what the effect of the epidemic is going to be on drinking in general, and let alone drinking among college students. Now, there are lots of predictions, and some of them have some decent theoretical or literature supporting what might happen. There's, for instance, a lot of fear that there will be increases in alcohol use disorders by the end of this. Now, from the media, we do have some data that's been reported widely that alcohol sales increased dramatically during the lockdown. And, the number that got bandied about was 55%. And that's may or may not be true, but if you look at all the indicators that are out there, it does look like there was a pretty good spike in alcohol sales when the lockdown began. And starting sometime in mid to late March, you really started seeing alcohol sales go up. The other thing that happened and this again was regionally, differed regionally, but alcohol sales restrictions were eased in many places. So in the past, it was very rare to have to-go cocktails unless you lived in certain parts of the country. New Orleans used to have it or has it. Vegas has it. There's certain places that are tourist or party destinations that were tended to allow on the street alcohol consumption or to-go alcohol beverages, cocktails. But in a lot of areas, this was not the case. And to ease the economic burden of the shutdowns, a lot of states allowed alcohol sales to go. And that, I think this is now becoming something that might end up permanent in places. And it's worth noting now, we'll talk more about this later in the presentation, but these types of changes might change the way college students get alcohol, the way they consume alcohol. And it's something worth noting. Home delivery increased exponentially during this period. Again, so it just became easier. There were more ways to get alcohol, and as we know from alcohol research, as availability goes up, so does alcohol consumption, and then lagging behind that is alcohol-related problems. Now, bars were closed in many areas, and so one of the things I'd like to note here is that how bars are licensed vary from state to state. So in California, for instance, there's a number of different types of alcohol licenses, from things that would go to wineries or craft breweries, craft distilleries, where you could have a tasting room, all the way to, then restaurants, which have to have a certain percentage of food, and bars that serve food, and so on. So there's different types of licenses. In a lot of areas, bars themselves were closed. And what's reopening in a lot of places now are the establishments which have food service as well. So in some locations, it's not unrealistic to think that those college-oriented bars where they pack hundreds or thousands of kids into one space and serve cheap alcohol might be kept from reopening. And some of these places might close for good. Again, we'll come back to how bars might change their business models around this. And then lastly, virtual happy hours became a thing, and they became a thing almost overnight, which was interesting. And we'll come back to this as well, because I do think there's some preliminary evidence that the way people drank virtually was different than they drank in real life, and probably in a less dangerous way. So we'll come back to that as we talk further down the road here. So what are universities worried about? First, this idea of super spreaders. And I think if you look at the COVID data that's out there, the morbidity and mortality statistics, there's not this huge concern that college students are going to have high death rates because of this, because they tend to be healthier. And if you look at the data, while there are some young people dying from it, the vast majority of people dying from the infection are old. But this idea that they could be super spreaders, interacting with faculty, folks like yourself, staff, and then going back into the community with people that they work with and their parents at the holidays and so on, is a concern, a public health concern. The other big concern that administrators have is the disruptions in the academic year. And I think that if you look at the chaos that happened in the spring semester in a lot of places, where you had to rapidly pivot from in-person to online, was eye-opening for a lot of universities around the country. And so those types of disruptions in the future, in a way to kind of mitigate those problems should this kind of situation occur again, either with COVID or something else, has been something that administrators are deeply concerned about. Another conversation that's kind of come up that I've heard repeatedly is the potential for delay in time to degree and the increased loan debt that students will take on because of this. And there's actually, if you dig a little deeper, there are other types of situations at several campuses. For instance, parents will sign a year-long or a 2-year-long lease for their child to live with roommates off campus. And so what happens if campuses go online for a semester? Do they send the kid back? They can't really break the lease. So there's all kinds of implications around that increased debt aspect. And then at a more macro level, there are concerns about economic disruptions to universities that actually lead to university closures, permanent university closures. And, in our field, we probably are a couple steps removed from this. But again, when I was a dean, it was interesting to know that there has actually been a trend towards universities and small colleges, especially small liberal arts colleges, failing economically. And part of that goes with rising costs. Part of that goes with trends in enrollment. But this pandemic certainly is adding stress. Actually, there was a headline today in one of the, I think it was Reuters, that had an article about this where, they're predicting several small universities will actually shutter their doors because of the epidemic. So the longer this drags on, it's a problem. The other piece of this is that the mitigation efforts that universities had to put in place, and we'll talk a little bit more about that in a second, cost them a ton of money. And so even on schools with kind of deep coffers, the potential for real economic stress is great due to this. So when I raise this just so when you're talking with your own administrators, you can kind of have that in the background, that they're really kind of thinking in ways similar to business leaders, where how do we keep our doors open during this and not have to lay people off or have furloughs and the like. Okay, so what are colleges doing? Again, there's not a ton of data here. I talked to a bunch of administrators, probably at about 10 different schools before doing this. And then the Chronicle of Higher Education has run several articles, and there's several online forums. But it varies widely. Again, I'll show you a graphic in a minute. But for the most part, most universities are going back face to face. Now, they're going back face to face, but often with some sort of change to the way they're offering courses. So, and it varies again from university to university. And I'll talk about some of those things in the next slide. But one of the things that I thought was pretty concerning in the people I talked to, who ranged from vice presidents of student affairs to provost level people, was that often the COVID-19 prevention policies were being developed without consideration of how alcohol use among students might pose a problem. And I found that very interesting, because as you can see, I'll go to that slide next, where what campuses are actually doing. But this is out of the Chronicle a week or two ago. This is a living pie chart, so these numbers might have changed. When I pulled this down a week or two ago, 65% of the campuses were reporting they were going to be in person. There was a bunch doing a hybrid type model. Some were going straight online. I think the biggest online system is the CSU system in California, with 20 some odd campuses going mostly online. There's a limited number of on-campus offerings USC, where I am, would be a typical kind of hybrid where you're going to have some things online, some things on campus. And then as of 2 weeks ago, there was still a big chunk of that pie that wasn't certain on what they were doing yet. So the situation is still dynamic. All right. So here are some of the common responses that we've seen. Rotating live sections. For instance, at USC, they've looked at the square footage per room, and then they've calculated how many students they can get in each classroom to maintain physical distancing. And then they take that number and they figure out how many class sessions there are, and they allow a certain number of students to come in person. Other people can come online. Again, my university, mandatory face masks for anyone on campus. They're talking about disciplinary action for students, faculty, and staff not complying with the mandatory face masks. There will be more online offerings at many universities, and I think a lot of that started last spring. And just as an aside, I'm guessing that the way online education is delivered is also going to change because of the epidemic or pandemic. There will be accommodations for at-risk groups, and so this is again an interesting type of problem for universities. My dean, for instance, is in an age cohort which doesn't allow her on campus. So some senior administrators might not be able to come on campus. Some professors might not be able to come onto campus. People with compromised health might not be able to come onto campus. So it's going to cause ripple effects throughout the system. Enhanced cleaning and sanitation. Now this one probably you're not, it seems like a no-brainer, but actually this by itself causes a ton of problems in the number of times per day that they have to sanitize classrooms. Means that the time between classes and the costs of cleaning crews at some universities have skyrocketed. Again, more economic strain. And then of course, a lot of people are doing early start and end dates, with the semester either ending completely or going to virtual on the Thanksgiving break. And then several campuses now are doing some variation of health monitoring, where if you're on campus, you will have to answer some health screening questions in lieu of the testing that isn't available in a lot of places. And realistically, you couldn't test everybody often enough to make it possible to do it on a college campus anyway. But there are a number of universities who are going towards health monitoring apps as well. Okay, so how will students comply to COVID-19 prevention efforts? And I'm guessing that this is actually one of the things that has a lot of you here and up at night worrying about, because if you look at everything that was on that previous slide, it all goes out the window on the first weekend night, and depending on your campus, that could be Wednesday or Thursday, where students start to drink. Now, will some students comply? Certainly. Will the bulk of them comply? It's, as we've seen, it's probably not likely. So right now, as of today, there's no real data on whether college students are compliant with the best practices to prevent COVID-19 versus the general population. There are two studies that are out. One, I think, came out yesterday. This other one came out a month ago or a couple of weeks ago, that liberals are more, people with liberal views are more likely than people with conservative views to comply with prevention guidelines. The second study that I haven't been able to get my hands on, but I read the media view of it, or the media presentation of it yesterday, found the same thing, and that women were more likely to comply than men. As I've noticed before, though, there's also this wide regional variation in compliance. So states vary, but then cities within states vary, and so on. We're not really, the picture on compliance and who complies is not crystal clear at this time. And as we know that there's kind of this quarantine fatigue, people are anxious to get back out. And I think especially among students, I have a college age son myself, they're ready to get back to living, which poses a challenge for the best practices to prevent this. Okay, so what can the literature that we do know for other health behaviors tell us? All right, so I was able to kind of look through, interestingly enough, there's not a whole lot of literature on college students complying to alcohol related programs. Some, mandated programs when students are forced to go through basics or something like that. There hasn't been a lot of, there's studies on whether the programs are effective. There's just not huge studies on compliance, although when it's mandated, it's probably pretty good compliance. But we can think of condom use as maybe a proxy for this, and it's not the best proxy, but it's a proxy. The literature, and there's several studies on this, basically suggests that only 25% of college students use condoms regularly if they're sexually active. And that's regardless of the relationship status. So compliance to health behaviors in this age cohort is not super high to begin with. Lowest adherence for condom use was heavy drinking males. This was found in the study that I've cited there, but it's also, I think, been replicated in a couple other studies. And then if we want to take the conservative, liberal thing forward, members of the Greek system have been shown to have the most conservative views on campuses, and also to be among the heavier drinkers on campuses. All right, so when we look at this together, the takeaway is we really have our work cut out for us to not see scenes like this in the fall and into next spring if the pandemic continues to be a risk. All right, so let's shift a little bit now and talk about how drinking context might change. And again, there could be widespread variation. I assume there's going to be widespread variation, let's just say that, on a continuum where some campuses are going to look pretty much like they did last year and the year before, and other places are going to look drastically different, and which is a unfortunate natural experiment that we're all going to live through, but it makes our work that much more challenging. So in some locations, I think there will be a shift, or there's a potential shift to smaller parties. So some campuses that I've talked to, including my own, are talking about banning large events, and anything that is campus sanctioned, including fraternity and sorority, student clubs, athletics, band, those sorts of things. They're talking about putting a ban on the number of people allowed to congregate. So this is would potentially lead to a shift towards smaller parties and drinking contexts. So what do we know from the literature that can kind of inform us what that might do if that was to occur? The first thing is that a lot of college parties, small parties, tend to be BYOB events. And there's a number of studies that have shown that BYOB events tend to be wetter or heavier drinking events than events that are not BYOB. For the simple reason that students tend to bring more than they can consume themselves, so you end up with a ton of alcohol at the party. So we've got that to consider. in general, there's less regulation of alcohol at private events than there are in public venues. Again, there's regional variation here. But for the most part, party hosts don't monitor what their guests are doing as much as people might get monitored in a bar or restaurant. This could have some implications on a reduction in DUI. So if students, depending on your campus setting, are driving to go to a bar district like they do in some of the bigger cities where campuses are in an urban context, we might see a reduction in DUI if things shift towards smaller events. That's something that's, only time's going to tell. From a COVID perspective, smaller events give us a better chance of contact tracing should there be an outbreak. So if you have a party with 5 to 10 people, it just makes sense that it's going to be easier to figure out who was there in comparison to a party with 100 or 150 people. So prevention focus, what are the things some of us are already doing around this, where we can kind of use the tools we already know to look at COVID and alcohol at the same time? Well, we have party patrols. I believe the Higher Ed Center has some resources about this. We have social host ordinances in place in a lot of locales. We have responsible host training programs out there. And one of the things that would be fairly easy to add to the kind of existing responsible host trainings is something about social distancing and COVID mitigation. So it would be very possible to add things like, okay, get everyone's name who was here, spread things out, have sanitation places, do it outside. All the kinds of best practices I think are easier to implement in these smaller contexts than the bigger contexts. Okay, in other locations, I think, as I mentioned earlier, there's going to be a shift to bars having a lower head count or capacity that they're allowed to serve. Now, there's some studies that have kind of shown that college-oriented bars are notorious for not complying with head count, fire code head counts. I did a study years ago where we were actually taking the head count and breathalyzing people coming out of bars. The things that made the bar owners the most nervous was the head count, because they were actually in violation of fire code ordinances. Now, the type of bar license that the bar holds drives to a certain extent their business model. So places that have to sell food, so it's a food and bar type environment, can offset some of the capacity loss easier than places that are just a bar environment. There will be some locations where bars will be one of the last things to actually be open yet. And so in San Diego right now, most of the licenses are bar and food. And a lot of those places are open, and they're supposed to be open with safeguards, limited capacity, and so on. And they've already had to shut down a couple of them for violating that. So this will kind of be an ongoing battle. But as you see bars disappear, something in the environment, if you see bars disappear, because it's not going to happen everywhere, you might see other things coming into existence. So here we come back to the to-go cocktail kind of model. Is it going to be possible for college students to go to a place they used to go to as a bar and get drink specials and take them out? My son happens to be 20, his girlfriend's 21. There was a bar down the street where they went in the other day. people were walking out with 7, 8, 9, 10 drinks at once. So those kind of responsible beverage service practices that some bars have adopted are not necessarily going to be enforced on to go. So we've got some work to do there. So I think there's an opportunity here for RBS to play a bigger part. Certainly the conversation's changed. College students are incredibly price sensitive in most places. It's not universal, but in most universities they're price sensitive. And so with reduced capacity to serve people, one of the ways bars will likely stay in business, and I've talked to a few bar owners about this, is there will be increases in their prices. And so this again leads to, it might change the way students engage with bars down the road. Now, there's this other piece that's kind of playing in the background with DUI, and it's possible that DUI will increase because of COVID, even though it probably went down in the initial period of the lockdown. I ventured a lot that it went down during the thing. And that's because Uber and Lyft have taken massive hits here. There's some good studies out there that show college educated people and college students are among the largest rideshare users in the country. And there's also some good evidence that in places where rideshare usage is up, traffic fatalities is down. And so the strain of the epidemic put a lot of those folks out of work. Whether they come back or not remains to be seen. And whether other people that use rideshare services are going to be comfortable getting into a stranger's car and not knowing what the sanitation of the car is like might play a part in this. So I think DUI, especially because that is the leading cause of death for college students, alcohol-related death for college students, we really need to watch that carefully moving forward. Prevention focus here again is responsible beverage service. Okay, so what do you do if you're on a campus that's doing nothing for COVID-19, and there are some out there? It's business as usual. Keep doing your comprehensive programs, consult with the higher ed center, college aim, tools, etc. But I'd like to strongly advocate that if possible, you monitor drinking in among the student body. It's a best practice anyway. It's not always the easiest thing for us to do. Surveys cost money, etc. But even if you're just trying to keep your pulse on how students are drinking, that would be important. Use focus groups. You can use other methods. But has there been any shift in the way students are drinking? Are they drinking more in parties, less in bars? Are they drinking in smaller parties, and so on? All these things have potential implications, both for alcohol prevention and COVID prevention. If you're on a campus where you're doing some hybrid of both, your campus administrators are trying to address COVID-19 and alcohol-related problems. In the best case scenario, you encourage and adopt best practices for both. I do think one strategy that a lot of the folks listening to this could take is to really stress that you can do the best kind of COVID mitigation strategy possible on your campus, and it all goes out the window if students are not going to comply on the second they're off campus. So it might keep professors safe, it might keep staff safe, but it's not going to stop that super spreader thing that concerns a lot of public health officials and college administrators. This might be an opportunity to talk about banning larger parties. Now that could be a double-edged sword. So the literature on large parties is somewhat mixed. I did a study years ago that found larger parties actually had lower blood alcohol content averages among participants than smaller parties. At the same time, a colleague of mine, Bob Saltz, had a study that showed larger parties resulted in more problems. And I think if you look at that logically, it actually makes sense. There's more people at larger parties, but sometimes there's less alcohol because there's kegs or people are crowded around kegs. So the potential for problems is greater. Alcohol-related problems is greater, while people might not be as drunk as they are in a smaller setting. But from a COVID perspective, we pretty much know large events are a risk. I think engaging with fraternities and thinking about harm reduction strategies, making them partners in this is a potential important thing. As you move forward, if you're on a campus where your fraternities are kind of the host to large open parties, it might be time to talk about having, getting them to agree to smaller controlled events, maybe with one other organization. The same would go for clubs on campus. So the idea is really doing anything you can to chip down at those big events where you're going to have a bunch of people interacting kind of in random ways. Again, social host materials could combine COVID prevention things for responsible alcohol service, and so on. Okay, a couple other things to consider, and then we're going to open this up for questions. There's one of the things that came up when I was talking to some people in preparation for this is they have a campus that has gone online, but two other campuses in their area are business as usual. So there's potential for this kind of cross-town contamination where students who are at the closed down campus are looking for social experiences on the weekends or at campuses in the region that they are not students at. So that's something to consider. It'd be worthwhile to network with your colleagues on a regional level to kind of see if this is going to be an issue moving forward. I think one thing that happened during the epidemic is we all got saturated and very good at using Zoom, including, as I mentioned earlier, Zoom as a way of drinking. So people are used to virtual kinds of events right now. So this could be a time to consider if your campus is still in this shutdown mode, can you offer virtual events for students that are positive? And then can you create small alternative events, be them drinking events or non-drinking events outside in safe spaces for people to be able to kind of physically distance. The study I mentioned earlier that I'm working on is looking at how when people drank on Zoom, it changed or potentially changed their behavior. And hypothesis here is that for a lot of people, Zoom changed the way a happy hour kind of played out in that people drank a little bit less and talked more. And so is there something there that we can leverage? Remains to be seen, but it's worth kind of thinking about. And then again, I think it's really important to kind of look at how alcohol service and sales practices might have changed and carried over when economies reopen. So, is there to-go alcohol now that you didn't think about before, and you've got a new risk? If there is, you've got to start thinking about how are you going to address that. At the very least, can you set minimums and the number of drinks that can be sold to one person at a given time, so you don't have one person who's 21 going in and buying 10 drinks for a bunch of underage folks. Can you set price kind of limits or encourage price limits? You can't set them, but can you encourage them and those sorts of things? All right. So the last one is one that I had down, and then this was before the civil unrest started, in the Black Lives Matters protests started. But there's a lot of people studying the movement of college students towards attitudes consistent with social justice activism. And in some ways, the COVID epidemic might be an opportunity to engage students in a narrative that is social justice related. You're not going to get everyone this way, but it's a way to at least engage maybe certain groups of students. The fact that Black communities have been disproportionately impacted by COVID is something that students really should understand. The whole age and ageism piece of this that we saw early in the epidemic is something for students to understand. So to the extent you can start to perhaps frame the way they use alcohol and behave in terms of COVID as their social responsibility to greater society might actually be something that we can look at moving forward. So I'm going to, and I have extra time to talk to if there's questions. Summary, this is no great insight here. We're entering a period of extreme uncertainty and variation, and there's really a great need for data collection for us to share experiences and collaborate. Jim Lang, the director of the Higher Ed Center, and I are actually going to field a survey. We probably will hit most of you up to find out what's actually happening on your campus related to this issue and some of the things we talked about today. So with that, I'll open it up for questions, and thank you.
Thank you so much, Dr. Clapp. And as he shared, we welcome all of your questions. Please submit them in the Q&A box at the bottom of your screen. We did have a few questions that came in during your presentation, so I'll get started with what we have. What kind of disciplinary action is your school going to pursue for those who do not wear face masks while on campus?
So for students, they're talking about kind of the first time they get a warning, the second time they're banned from the live campus event, then that pushes you into the online stream. For staff and faculty, they're literally talking about, a couple strikes and you're suspended, and you don't do it ongoing, you're out. So they're taking it very seriously on my campus.
Dr. Clapp, we've had a couple questions come in around responsible host training. Do you have any, could you share a little bit more about perhaps some models that exist or providers that would be available, and if you've heard of any that are already incorporating factors related to COVID-19?
I haven't heard anybody who's incorporating it yet. Now, as far as materials, they're actually back in the day when it was the U.S. Department of Education's Higher Ed Center, we developed somewhere, and it lives in the archives, a guide for responsible party hosts. That if you can't find it, Cindy, you and I can talk offline and maybe put something together, because it's not super hard to come up with a kind of a checklist, and adding the COVID piece to it would be very easy. But I think we could put something together very quickly. To date, I don't know that anyone's combined the two though, and maybe someone here does. Put it in the comments.
Thank you, Dr. Clapp. For communities who are reducing their reliance on police departments, are there other entities that can be utilized on campus to help with party patrols?
Yeah, and I don't know that police are the best folks to do it anyway. I know some campuses use student groups to go out and do it, and it can be. It depends on the focus of the patrol, right? So if it's becoming an arm of enforcing a policy, then it kind of sends you down one path. If it's more educational and like, here's a warning, but you really can't be doing this, it sends you down another path. But I do think you can use student volunteers that are trained. Some places I've consulted at a couple smaller schools in the Midwest that actually use staff members and faculty to kind of walk the streets. And there's actually one place had their provost would go walk around the neighborhood on weekends. So there's a lot of different models out there, but I don't think you have to rely on police. And given the current environment, it might not be the best approach. I have done it in the past, back when I was at San Diego State, with a police officer who was kind of the community police officer, and he, every frat president had his cell phone number. He knew them all by name. There was a good relationship. So you can build those kind of relationships with police. It just takes time.
Dr. Clapp, you mentioned earlier about the importance now, perhaps more than ever, around monitoring student drinking. Could you share more about some of the strategies that campuses can use to do that?
Sure. So the best strategy, if you can pull it off, is some sort of regular survey. And sometimes you can do that, sometimes you can't. I don't, if I take my scientist hat off, I'd say it doesn't necessarily even have to be like a random representative sample. Sometimes getting data, you're not worried so much about the epidemiological precision of the tool as much as kind of where students drink, how they drink, what kinds of problems are occurring in what kinds of settings, which allows you to kind of direct your prevention efforts. If you can't do a survey, the next step is a series of focus groups, and that would be maybe a potential webinar down the road, how to hold a focus group. Fairly easy to do, fairly inexpensive, but you can learn quite a bit. Higher Ed Center has, again, going back to the old Higher Ed Center materials, has a whole bunch of things on environmental scans and how to scan the environment. So those are the types of monitoring tools that I'm kind of advocating that are going to become probably increasingly important while we got this uncertainty.
Dr. Clapp, what suggestions do you have for marketing medical amnesty, Good Samaritan policies? This individual is concerned about students hesitating to call EMS for overdose situations out of fear of violating COVID restrictions. Administrators are worried about mixed messages if we provide amnesty for COVID policy-related consequences.
It's a good one. So, to understand the question, so you're saying like a scenario where there's a student who's gotten themselves into trouble with alcohol, but they're violating COVID-related party type of thing. Is that the question?
Yeah, I believe that is my understanding as well.
Yeah, again, I think what you have to do here, it's the same as amnesty kinds of situations in general. You really need the campus president to come out and clearly say they support the amnesty efforts. Okay, so you just, I've seen this at campuses where the president will make a very strong statement about it, and they do get an increase in EMS calls, versus places where you get a lukewarm kind of like, yeah, we have it, but the students don't know about it or they don't believe it. Or there's some mixed messaging because they know somebody who got thrown out even when they called or got in trouble. So you have to be very consistent with the message and the way that policy is enforced.
Great. It is 3 o'clock, but Dr. Clapp said he would stick around with us for a little bit longer to answer your questions. We've got a few coming in. We've also been posing a few questions into the chat that are more asking about what campuses are already doing or resources you may already have access to. And so if you haven't been paying attention to the chat, I encourage you to do that. There's some resources there as well. If you're at a campus who has already been developing social norming campaigns or perhaps have materials for training students to conduct party patrols, those are some of the questions and resources people are looking for. So I encourage you to share any resource that you might have, and a few people have already done that. So I encourage you to take a look at the chat. Dr. Clapp, the next question is more around drinking motivations for students. We know that college students are often mention the social aspect of drinking, but with the shift in social environments, do you think we'll see a change in alcohol use, such as drinking alone, or an increased use for coping with stress or anxiety?
Yeah, that's a great question. And the answer is yes. If you think about why there was that spike in alcohol sales at the beginning of this, two of the main motivations that come up over and over again when people study motives to drink, beyond the social one and to have fun, which is the college students' number one, but the next two are to relieve boredom and to alleviate stress. And so if you think about what happened in the quarantine, you had a whole lot of stress, very uncertain times, still uncertain times, and you had this kind of isolation factor. And so I do think for some people, you'll see a shift, and for some people, and we'll need research here, that shift that happened during COVID might carry forward. I'd hypothesize that people that are highly germ phobic or might have a compromised immune system will be at even greater risk for that kind of a shift towards drinking to cope. On the flip side of that, there might be, and I've seen, this is just anecdotal, but there might be a move towards students who are changing the way they drink in other ways. So think of the number of college-age students who went home when this started, right? And there was a lot of, more than I've probably ever, people drinking with their parents. And the way parents drink tends to be different than the way kids drink, in that there's more of this kind of becoming a connoisseur, pairing food with alcohol or drinking high-end alcohol and so on. And so we might start seeing some of those shifts where the relationship between alcohol and the student might have shifted, their attitudes might have shifted based on 3 months of being at home.
Thank you, Dr. Clapp. How can we convince university administrators to adopt a harm reduction approach for COVID prevention like we do for alcohol? I.e., we say we know students will drink, let's make that safer. How can we convince admins to acknowledge that students will socialize? We just need to do what we can to make it safer.
Yeah, I think the key here is to go back to what I said in one of those early slides, is this is, like it or not, a very big economic issue for campuses. And to the extent that there's an outbreak on a campus and they've spent a bunch of money trying to come up with all these mitigation strategies and prevention strategies, it's money lost to them. And if they need to shut down or pivot again, that's even more money lost. So I would frame this as it would be important to adopt these harm reduction strategies, not only because it's the right thing to do for alcohol and it's the right thing to do for COVID, that it's going to possibly prevent the loss of more revenue to the university in the long run. Unfortunately, that's one of the things that tends to get administrators' attention. And by extension, it starts to get faculty's attention. When faculty start to see enrollment go down and getting furloughs and those sorts of things, everyone will be a little bit more motivated, I think, to try to do the right thing here and put stuff into place that will reduce the harm.
Dr. Clapp, we've gotten a couple of questions that are cannabis related. Could you just give your thoughts on whether you have seen in your literature review any change in cannabis use related due to COVID-19, and any kind of just brief recommendations you might have for campuses that are looking to address cannabis use during this time?
Yeah, there's no literature per se that I've seen. I did find it interesting in a lot of the states that are recreation legal, that dispensaries were considered essential. And so, marijuana sales did not, at least in my part of the world, didn't seem to be harmed much by the pandemic. If you think of COVID as a respiratory disease, there's a couple things you would probably want to do related to marijuana. One would, this kind of the communal dab pipe or bong or passing the joint around or whatever, probably should go, right? So that's just the basic harm reduction thing, and that might be built into the party strategy. Beyond that, I don't know that we really know much about what marijuana consumption is going to do, either for COVID risk or how it might have changed during the pandemic.
Well, thank you so much, Dr. Clapp, for sticking around to answer these questions. We don't want to take up too much of your time. We do just have a few housekeeping slides that we would like to review. We hope that you can join us for our next free webinar titled Alcohol and Hazing, Examining the Intersections and Considering Implications for Campus Prevention, taking place June 24th at 2 p.m. You can register by following the Go link on the screen. We're also excited to announce the registration for the 2020 virtual national meeting is now open. Although we are unable to meet in person this year, we are excited to bring a virtual conference experience geared for campus professionals working in the field of substance misuse prevention and collegiate recovery. Join other attendees for the opportunity to learn about issues impacting collegiate substance use across the continuum, evidence-based practices, and how to implement them in a sustainable and impactful way, as well as networking opportunities to meet others from across the country. You can register by following the Go link on the screen or by visiting our website, hecaod.osu.edu. And just a friendly reminder that this session's recording will be uploaded to our website and YouTube page within 3 business days. Thank you everybody for joining us today, and we wish you well and stay safe.